大家好，我叫陳健。大家好，我叫陳健。So my name is Lily Chen. It's a different name than Jen Chen, but I am the executive director for United Chinese American WAVE, stands for Wellness, Advocacy, Voices, Education, and Support. First of all, I want to thank you, Ethan and Soha, for your incredible, powerful voice. As a parent of 5 children, I wish I knew what you were experiencing. I think the mental health crisis, youth crisis, is it takes a whole society effort. While we face so many structural challenges, many of you have experienced, and parents also play a critical role. I wish I knew what I know now about what my children experience, and also the mental health knowledge I didn't have, even as a nurse educator, because I immigrated from China. I didn't have a psychiatric nursing education in China. And so that's our youth mental health collaborative focusing on parent education. Of course, we love to hang out with you guys too. And we just have a 2 focus group this weekend. One consists of 13 Korean refugee youth, and the other focus group is about 4 or 5 youth. So the focus group is one of the examples of advocacy we're doing. We're actively serving the community as a community-based organization while building our own research capacity. I 100% agree with you, Sandasha, about investing in the community-based organizations on their research capacity. Nothing about us without us. Because we are the one closest to the problem. Therefore, we know the solution, the best fit into our community, especially in a cultural linguistic minority population. I have 1 minute left. And I will give you another example how we build our data. We're doing the mental health first aid training. Thank you, SAMHSA, for sponsoring that. We build our evaluation to evaluate the effectiveness of the culturally adapted Chinese curriculum. For example, give you a data point. We have 1,013 people attempted to register for our training last year. Only 259 were trained. 33% of them stopped registration when they were asked for names because of the stigma. That's our interpretation. And also, we find out another data point about our mental health first aid training is about 13% people would like to have help, couldn't get help. 19% of the people, the help wasn't right for them or couldn't find. So these, I think the solution, not only we need to invest in community-based organizations, we need investment for the capacity to build our own research capacity while collaborating with the researchers. Thank you so much for your time, and thank you again.
Good afternoon. My name is Elaine Peng. Thank you so much for providing this great opportunity to hear the voice of our community. I'm so grateful. So I'm the founder and executive director of the Mental Health Association for Chinese Communities. So I'm so happy to be here to learn from you guys because I learned a lot. Thank you. So talk about the I found an organization is the peer-run community-based organization. So this organization, I think, is why we found this is because the very big is a language asset. We want to help the people who had the language barrier. So actually our 819 yesterday just received a call. The woman who diagnosed the depression, she quit the treatment because she don't understand what the psychiatrist talk about. So that's made me to think think about another things about the Half Moon Bay, the shooting, right? The shooting before the tragedy, Mr. Chow, because I already contact with him, the government had a serious mental health condition, but he did not know how to take the medication, done to not know enough English. I was shocked when I heard his from him. Yeah, because this one his condition was not well controlled in the past years before the tragedy. It doesn't excuse his actions, but rather shows the deep need for the prevention and early intervention to help avoid these things, right? So our 819, we provide every day for 12 hours, yeah, service, fee service. But just like Dr. You said, yeah, we at least the grant, we only received the 3,000 in the past 10 years. So and this grant, the funding is from the California alumni. So yeah, we try our best to service community, but we need a lot of support. Yeah, thank you. I know the time is up. Thank you so much.